After several investigations for Roxana's mother, the doctor informed her that she is at a high risk of atherosclerotic cardiovascular disease. And she must take oral aspirin, acetyl salicylic acid, 75 mg once daily. But Roxana's mother was confused. She used to take aspirin for pain relief, so she asked the doctor about the role of aspirin in her case. Aspirin is used for the primary prevention of atherosclerotic cardiovascular disease, ASCVD, in adults from 40 to 70 years. Moreover, aspirin has many other uses. Antiplatelet therapy in ischemic stroke and transient ischemic attack. Antipyretic. Adjuvant antithrombotic therapy in acute coronary syndrome. Anti-inflammatory. Analgesic. Roxana's mother was surprised by the various uses of aspirin, and she asked the doctor about the origin of aspirin. Thousands of years ago, people were using some parts in the willow tree, especially its bark, for pain and fever relief, and because the weed's bark contains salicylate, its effect as an analgesic and antipyretic was impressive. In 1899, Bayer released aspirin, which proved its efficacy throughout these years and until our era. The doctor answered. However, some patient categories mustn't take aspirin. Patients with hypersensitivity to aspirin or any other non-steroidal anti-inflammatory drug, like ibuprofen. Patients with high bleeding tendency. Patients suffering from asthma. Children who are less than 3 years. Children with viral infections due to the high risk of Reye's syndrome. Also, patients with heart failure should avoid high doses of aspirin. What about the adverse effects of aspirin? Roxana asked. The doctor highlighted that although the incidence of aspirin adverse effects hasn't defined yet, some people may experience nausea and vomiting, rash and urticaria, bronchospasm, hearing loss and tinnitus, angioedema, hepatotoxicity and renal damage, bleeding, gastric ulcer, gastrointestinal pain, salicylate-induced pulmonary edema. Thank you for watching this video. If you would like to watch more, please like and subscribe.